The World Health Organization, or WHO, has raised its tally of confirmed human cases of H1N1 flu to 615 from 365, and it is expecting the alert level to reach phase 6, the maximum. So far, there have been 17 confirmed deaths worldwide. Pei Jian has more details.
The World Health Organization's alert level remains at phase 5 of 6, meaning a global outbreak is imminent. The WHO says it has sent 2.4 million treatments of the anti-flu drug Tamiflu to 72 developing countries. So far, 15 countries have now reported laboratory-confirmed cases.
As of 6 a.m. GMT today, 15 countries have officially reported 615 cases of H1N1 influenza infection with 17 deaths. Mexico has reported 241 new laboratory-confirmed cases and 7 new deaths since 23:30 GMT of May the 1st. The increased figures from Mexico reflect primarily ongoing testing of previously collected samples and not a surge in people falling sick.
Meanwhile, Mexican authorities said on Saturday that the country's death toll from the flu remains at 16. No new deaths were reported overnight. Officials were optimistic that the worst was over at the epicenter of the outbreak. Workers have been sent into the subway system to disinfect station facilities, while others offered gel to passengers to wash their hands. At Mexico's intelligence unit for health emergencies, teams of doctors and scientists are monitoring the spread of the outbreak. They are in frequent contact with the Atlanta-based Centers for Disease Control, the World Health Organization, and other institutions. CCTV.
Over in France, the country's health minister says there are 440 suspected H1N1 flu cases. That's up from 350 suspected cases reported the day before on Friday. Rosaline Bachelot said the number of confirmed cases having the virus remained at 2, but she said there was also one other very probable case. The 2 confirmed cases include a 49-year-old man and a 24-year-old woman. Meanwhile, French authorities are continuing to track down people who came in close contact with the 3 patients. French health officials have developed a test that allows them to diagnose the virus in a matter of hours instead of the several days previously necessary. Over in the U.S., President Barack Obama says the strain of flu that is alarming the world is so new and poorly understood that it justifies the U.S. government's multi-pronged efforts to fight it. In his weekly radio and internet address on Saturday, Obama said his administration had thrown substantial federal resources into the campaign against it.
Out of an abundance of caution, I've also asked Congress for $1.5 billion, if it's needed, to purchase additional antivirals, emergency equipment, and the development of a vaccine that can prevent this virus as we prepare for the next flu season in the fall. The Recovery Act that Congress enacted in February also includes expansions of community health centers, a dramatic increase in the training of healthcare workers and nurses, and $300 million for the development and deployment of vaccines, all of which will help us meet this threat.
Meanwhile, departments in China ranging from public health to the quarantine authority are working to prevent the spread of the H1N1 influenza. China's Ministry of Health has ordered local health bureaus to set up special clinics for infectious diseases and fever. It has also ordered stepped-up monitoring and daily reports. The quarantine authority says all inbound passengers must fill in a health declaration form. All transport vehicles arriving from affected areas must stop in designated spots and use special channels. Meanwhile, the Center for Disease Control and Prevention has included the H1N1 influenza in its direct network report system. The network now covers nearly 97% of the medical facilities in China. Health authorities are seeking passengers who took the same flights as the Mexican H1N1 flu patient now in Hong Kong. The passengers on the flight from Mexico have flown on to other provinces after a brief stopover at Shanghai. Local health departments are working around the clock to track them. Here's Wang Guan once again.
The Health Ministry has issued an emergency preventive plan. The plan requires local health departments to trace people who took the same flights as the Mexican patient and place them under medical observation for 7 days. Health authorities in Shanghai have found all but 7 of the people from flight AM098 from Mexico who stayed in the city. 49 passengers and 13 crew members are under medical observation. Shanghai authorities have sent a list of passengers who have left for other provinces to other local health departments. 17 passengers on the flight have since arrived in Beijing. 15 of them are in hospital for medical observation, and the other 2 have been tracked in other provinces. So far, none of them have shown any symptoms of influenza. 41 other passengers on the flight flew to Guangzhou, capital of Guangdong Province. The Guangdong Public Health Bureau has put 39 of them under medical observation for 7 days. The Bureau has not yet made any contact with the other 2 Mexican passengers. The Health Ministry has provided Hong Kong with the information of all passengers on the flight which the patient took to Hong Kong. The Ministry is calling on all passengers on the flights from Mexico to Shanghai and Shanghai to Hong Kong to contact local health departments immediately. Wang Guan, CCTV.
Here in China, hundreds of tourists and employees were put into quarantine in a Hong Kong hotel on Saturday. The move came after a Mexican traveler who had arrived in the special administrative region had tested positive for H1N1 flu. Wang Guan has more details.
Medical workers are moving into the hotel to help the quarantined guests. On Friday, Metro Park Hotel in Wan Chai district, where the Mexican was staying, was officially sealed off. Police wearing surgical masks stood guard both inside and outside the hotel late on Friday. Guests were prevented from leaving and outsiders from entering. Emergency staff are the only exception. 200 guests and more than 100 staff will be quarantined for 7 days.
Shanghai.
Health Minister York Chow has urged taxi drivers who took the Mexican to the hotel and to the hospital to report to authorities.
We are entering the emergency level of the pandemic plan.
York Chow told reporters the man arrived on the China Eastern flight on Thursday afternoon after a stopover in Shanghai. He's now in hospital in a stable condition. 2 companions of the Mexican and the friend he met in Hong Kong are in isolation wards at another hospital. To tackle the H1N1 flu virus, Hong Kong authorities have increased surveillance at airports and stockpiled over 20 million doses of the anti-influenza drug Tamiflu. Wang Guan, CCTV.
With a confirmed case of H1N1 coming in on a flight through Mexico and through China, the government in Beijing has decided to suspend air services from Mexico to Shanghai. The Foreign Ministry says China has notified the Mexican government and also airline carriers involved. They say services will be resumed depending on the pandemic. The Chinese government is considering sending a chartered plane to the city to pick up Chinese passengers there who were scheduled to fly to Shanghai on Sunday.